Okay, so I am on with Dr. Adrienne Hill. Thank you so much for doing this with me. I'm really excited about this. I know that when we get a chance to talk, we can just probably do it for like 2 hours without even looking at the time. So hopefully we can keep this short and sweet for people, but wanted to have a chance to get you on here and expose some people to what you're doing, what you're trying to get started up, and just a different mindset surrounding medicine in general, which I think is sometimes refreshing to hear some different perspectives from people. I know that is the case with me for a lot of people from physical therapy side of things. So just try to stay in my own lane and let other people that are experts in other areas talk about their stuff. So with that, welcome. Dr. Hill, can you tell us a little bit about yourself, what you do, and everything you want us to know about your background?
Sure, absolutely. First of all, thank you so much for having me and taking the time to chat with me. And I'm super excited about the business that I'm getting ready to start. It's called Rehab Medicine of the Carolinas, and the idea behind Rehab Medicine of the Carolinas is to provide patients with an integrated group of healthcare professionals to help provide the most comprehensive solution to their problem, their impairment, their symptom. It's personalized medicine. It is specifically designed to help treat patients where they are. It is a whole person approach to medicine, a whole person approach to treatment. And it's multidisciplinary in nature. There'll be a physical therapist with me, as well as occupational therapist and a health and exercise trainer, so that we can all communicate together to come up with the most comprehensive plan to get patients feeling better, to get them back to normal, whatever that normal looks like. Mm-hmm. And the idea is for patients to become independent again, whether or not they've had a major multiple trauma, a traumatic brain injury, a stroke, spinal cord injury, whatever they've been through, even if it's cancer, a lot of impairments around cancer. The idea is to help patients gain control of their lives, to get back to that highest level of independence and to have the best quality of life as possible. I will be joining alongside the other medical providers that patients have, so that we can have that team-based approach to care. The oncologist is crucial for helping to make sure that the cancer doesn't return, to make sure that it's being treated appropriately. And I would like to team up with that provider to make sure that, we're addressing the other symptoms that patients are experiencing that the oncologist may not have time to talk about, such as pain or fatigue, weakness, nutritional deficits, depression, anxiety, you name it. Those are the kinds of symptoms that I'm interested in coming together with the oncologist to help to treat.
Yeah, and I think something that you and I have talked about a lot is that it's a positive and a negative that medicine today has gotten so specialized, because I think that's in a way the problem with things is that things are getting so specific with each discipline that certain things that may not seem as life-threatening or immediately an issue to, like, the oncologist that's just there trying to make sure that they can get rid of the cancer, that's their primary objective, but also knowing that diet and exercise and things like that are a great adjunct to any kind of cancer patient, or, like you mentioned, anybody with just really anybody with a medical issue. And I think it's really great that you're using this interdisciplinary approach, because I think that's obviously the goal in a lot of hospital systems and places like that. And, I think it's just really tough to make sure that, again, that the wellness side of things is addressed. And I know that from our conversations, that's really the big part that you're trying to get included in this, because it's something that can be life-changing for people. Can you tell us a little bit about your medical training background? Because I know you're a DO. Is that the same thing as a physiatrist? Is that
That's correct. So I completed my undergraduate training at Wake Forest.
Mm-hmm.
So I'm from a local. I'm from Winston-Salem, and following
Tar Heel, right there, Tar Heel.
Following my training at Wake Forest, I worked at Wake Forest Baptist. I did cancer research, and then I applied to medical school, and I was accepted to Virginia College of Osteopathic Medicine in Blacksburg. And that was a 4-year degree, 4-year training to become an osteopathic physician, which is a physiatrist. Following medical school, I went to residency at University of North Carolina, Chapel Hill, and in physical medicine and rehab. So my blood also runs light blue as well as gold and black. So that was a 4-year training as well. Had extensive training in spinal cord injury, pediatric rehab,
I think what's great
EMG.
about medicine is it just takes no time at all to get your certification.
Right. It has been a lifelong journey for sure. Chapel Hill was amazing. I learned just a wealth of information about how to treat patients with all types of impairments and disorders and diseases. And following residency, I had the opportunity to work at Wake Forest Baptist in the Stick Center primarily. I was the medical director for the brain injury unit. I did that for a few years, and then my practice changed where I was focusing more on outpatient clinic, and I also did inpatient consults for the Stick Center. My clinic was primarily spinal cord injury as well as neuro rehab for stroke, concussion, traumatic brain injury, as well as I had a large cancer rehab patient population. So the cancer rehab folks actually saw not only prehab, which I'll go into prehab in a few minutes, but also I saw patients all along their cancer trajectory, whether they were first diagnosed or while they were undergoing treatment or even following treatment, just seeing some of the patients who had either had late effects from treatments or just long-standing cancer survivors. Mm-hmm. So the climate at Wake Forest shifted a bit, and so I wanted to have more of an outpatient presence. And I really wanted to spend more time with my patients. It's very difficult to have a meaningful encounter with a patient in just 10 minutes or even 20 minutes for that matter. Mm-hmm. So the restrictions that were present in the academic setting, really, those are what drove me to start a private practice to where I could develop more of a relationship with patients and spend as much time as I needed to accurately treat that patient, to really understand the things that were bothering them and to come up with a personalized treatment plan for that patient. Mm-hmm. So, and I think medicine is becoming special. It's becoming so individual. It needs to be individualized. I think we learn so much from just listening to what patients need. And, oftentimes I think patients need to be treated in that personal setting where they're the only person in the clinic. They can go see the physical, they could see, the physiatrist, me, they could see the physical therapist, the occupational therapist all in one day. Mm-hmm. And not ever have to be in a large parking deck or with a waiting room packed with patients. So it's really a unique opportunity to I think minister to patients that have special needs, that have really unique medical conditions that may prevent them from feeling comfortable in a larger setting.
Yeah, so. And I think something that I try to tell a lot of people when I'm referring out or when I'm looking for a network of people is that I always look for a DO, and I don't have anything against MDs. I have plenty of MDs that I refer to. That's not the point at all, but I always like to have a physiatrist to talk to and to refer to, because I think you guys, more than the traditional sense, which sounds weird, but more than the traditional sense, kind of get this whole person, like, I need to listen to you. It's all on an individual basis, because I'm sure a question that you field a lot, whether it's from a cancer patient or from somebody with some kind of spinal cord issue or brain issue is like, to bring it down to nutrition, like what do I eat to be healthier? And it's like me hearing what do I do about my back pain, or like what weights should I lift to make sure that I'm in better shape. And it's not like you don't like I roll in front of them, but it's just, oh my gosh, it is so much more specific than just 3 sets of 10 of this and this. And it matters way more about who you are from an individual standpoint. And yes, it gets down into the sleep and the stress, but also, if we want to be specific with cancer, what kind of cancer did you have? How did it manifest itself? How long did you have it? I'm sure there's a lot more that goes into it than even I'm making it sound. And so it's really nice to hear that there are people that are internal medicine at their foundation that have this great amount of medical background, but they're not necessarily looking to throw a ton of pills at it, and their focus isn't necessarily on the, well, let's just focus all of our efforts on making this cancer go away as quickly as possible, which of course is needed, but it's more like, hey, let's make sure that these other parts are in play too, because that can enhance the experience that this person's going through. And to that point, I'm taking a long time to get to my point, but the reason that, again, I have a DO in my back, I always want to have a DO in my back pocket, is for the reasons that I just mentioned. But I think a lot of people mistake a DO for somebody that is, they pigeonhole you into integrative, or they'll call you holistic. And can you talk about kind of the connotations that go along with that, and where you like to be thought of in this grouping of people?
Sure, absolutely. And you bring up a lot of great points and things that I've, spoken with providers and patients about, because physiatry it's a relatively new area of expertise, but it's emerging as a much needed specialty, because what a physiatrist does is really, we're focused on function. We're focused on treating those physical and mental impairments, whether they are caused by congenital or acquired disorder. So we're really focused on the whole person perspective. For example, if a patient comes in with back pain, before that patient I think can really be treated effectively for their back pain, we have to take a systems-based approach, a top-down approach to what's going on in their home. Are they stressed? Are they sleeping? Are they anxious? Do they have weakness accompanying the back pain? Is there other things that we have to look at to really treat and figure out what's going on with it? Sorry, I'm not sure what happened there, but how can we best treat that patient and their pain? Are they overweight? Are they eating healthy? Are they getting adequate sleep? So instead of looking at that patient like they're just back pain, I look at everything else. Review their past medical history, review their medications to make sure that there's not multiple competing medications. And like I mentioned, it's a systems-based approach. And we physiatrists look at how medical conditions that affect the brain, the spinal cord, nerves, bones, joints, ligaments. We physiatrists will design a comprehensive treatment plan, even if that means to work on a nutritional plan, a pain regimen, and certainly there's a place for traditional pain medications, but I think they need to be used in adjunct with therapy, with other lifestyle changes, with other things besides medications, or in addition to potentially medications. So, and I think you're right, there is a connotation that a physiatrist is sort of an integrative kind of practitioner. But while that is one of the tools that we can certainly use, that integrative medicine, where we potentially with acupuncture or massage or herbal treatments, but the real focus is how can we medically treat this patient with all the tools that we have in our toolbox to help them achieve that highest level of independence.
Yeah, and I think it's a shame because I don't have anything against the holistic or integrative community whatsoever, the people that just really hone in on that spot. But I think for whatever reason, traditional medicine looks at it as kind of just nonsense that doesn't really help a whole lot. And then I'll get lumped in with that, and people will be like, "Oh, I heard you were holistic because you look at the whole body," and I have to be like, please don't call me that, because that's not quite it. Yes, I look at the whole body, and for whatever crazy reason, that's now considered non-traditional. But I get it. I get that certain practitioners maybe don't have time to spend with somebody, and I think that's the point that you're making, is that you're trying to open up a clinic that allows you to make time for them. Because I've had plenty of primary care doctors, whether they're MDs or PAs or whatever, come in here and go, I can't believe I heard you treat every back issue that is slightly different, or every case of sciatic slightly different. I treat it all the exact same. And it's not because I don't know any better. It's because I've got like 10 minutes with this person. And that's where I think the specialization of medicine has shot us in the foot a little bit, so to speak, and has made it a little tougher for traditional medicine to treat something that should be really simple, like back pain. And I think you and I would probably both agree on that, is there's a lot of different back pain patients that are walking around out there that just don't need to be in pain. And unfortunately, they've gotten the runaround of, here are these pills, rest for 6 weeks, come back to us if it's still a problem.
Absolutely. I think one of the key things that, a physiatrist and a physical therapist are very similar is we use our hands we use our hands to diagnose, we use our eyes. And, and that's something that, I think is really important when someone comes in, whether it's axial pain, neck pain, back pain, whatever the case, joint pain, we use our hands to evaluate that patient. We look, we watch them walk, we watch how they move, we watch, all these range of we watch, and we like I said, use our hands to feel for changes, to really fully examine the patient. And so I think not only is it an important diagnostic tool, but patients feel, and they feel like they've been treated when they have been examined with a doctor's hands.
Yes. And one of the best pieces of advice, and I think you and I have talked about this before, but one of the best pieces of advice that I've ever gotten from a mentor was touch them where it hurts. Just at the very least, they're like, thank you. That's the first time. I can't tell you how many times somebody said that to me in here. That I've been to so many specialists, physical therapists, chiropractors, that you were the first person to touch me where it hurts. And I don't mean like, there we go. I mean,
right.
Like actually try to feel the integrity of the area. And sure, there's probably stuff going on in there that you're not quite detecting, but I know, at least from my side of things, between hands-on and movement, I can usually get a pretty decent picture of that pain trigger, so that then we can make those lifestyle changes that don't involve me shoving a ton of pills down your throat, that can take that pain away almost immediately. So, and that's not just for back pain, that's for a lot of different areas that could be bothering you.
Absolutely.
So that, again, that's why I love that we've gotten to know each other. I love hearing what you're starting up, because it's really exciting. And you guys, if you're watching this, you should be excited, because I think you've talked a little bit about the people that you intend to help, but can you dive a little bit deeper into that? And just, I don't want you to feel like you're having to pigeonhole yourself into this one type of thing, but can you just elaborate a little bit more on who you're really going to market to and intend on helping primarily, especially as you get started here?
Absolutely. So the patients that I feel comfortable treating are basically from any and all backgrounds. I'm not pediatric trained, so I do treat mostly adults, and that's 16 and above. So the impairments that I'm plan on treating, and the patient population that I feel comfortable treating, are those with spinal cord injury, whether that's from a traumatic spinal cord injury or a non-traumatic spinal cord injury, such as whether it's a a tumor or spinal stenosis or herniated disc causing paralysis. So the patient with back pain, the patient with radicular pain, pain that shoots down the leg, patients who have had strokes, patients who have had and other non-traumatic brain injuries, such as subarachnoid hemorrhage or intracranial hemorrhage or tumors in the brain. So those type of patients, as well as patients with multiple sclerosis, other neurologic conditions, Parkinson's disease, cancer patients, I mentioned earlier, at any point along the trajectory, even if it's patients who are just been diagnosed and we're getting them ready for treatment, there would be a prehab service that's offered to help to optimize that patient's function so that they are in the best state and physically and emotionally and spiritually before they go into treatment, as well as cancer patients who are actively getting treatment or those who have finished treatment. And they have residual effects. So I also see patients with sports-related injuries, joint pain, patients who are having difficulty with endurance, like pulmonary rehab patients, pulmonary patients with, they're having a difficult time with endurance exercises or just going about their day-to-day routine, and they're getting short of breath. Obviously working alongside with the pulmonologist or the primary care provider to make sure they're medically optimized, but also working to make sure there's, factors in their daily routine that augment what the primary care or the pulmonologist is doing. And I'm talking about things like, pulmonary function tests, walk testing, smoking cessation, making sure they're getting home health services, that sort of thing, preventive vaccines. Also patients who've had burn injuries. Oftentimes there's issues with contractures, scarring, there's disfigurement, so there's a lot of anxiety issues, self-esteem issues. Patients with fibromyalgia, with lymphedema, whether it's from cancer or resection of tumors and lymph nodes, or just idiopathic, just unknown cause of lymphedema, as well as patients who present with they just don't feel well, and I can help optimize a treatment plan alongside with a primary care doctor to help them feel better. So those are the type of patients that I'll plan to see and that I feel comfortable seeing.
So I guess I can assume that you've also figured out how to clone yourself. Yeah, wow, that's awesome. Are you so you talked about it a little bit, but I want to kind of backtrack into it. And you mentioned the ability to spend time with somebody, and something that I'll say about myself a lot is I might not be the best physical therapist around, but I'm damn sure going to be the guy that can spend the most time with you and figure out your problem. And can you speak to the value of that it would have for you and your patients?
Absolutely. And that is just so important to listen to what that patient is saying. Patients need to feel heard. They need to feel understood. And they'll oftentimes tell you what is going on. They may not have the medical knowledge to put with what's going on, but that's how we work together as a team to come up with the treatment, to come up with the evaluation, whatever this is, the diagnosis that's going on, the diagnosis, the evaluation, and the treatment. We work together, and that can't be accomplished most of the time in 10 or 15 minutes. So being able to spend the adequate amount of time to really listen to what the patient is saying, and as well as the caregivers. Caregiver testimony is extremely important, because they'll tell you as well what the challenges are, sometimes more so than the patient will, particularly if it's a patient who may not want to admit that they're having cognitive deficit, or admit that they're falling, or they can't remember, and they can't express. So really listening to not only what the patient has to say, but the caregiver as well.
Hmm.
I'm really, really interested in caregiver education,
Yeah.
taking care of that caregiver so that they can be the best that they can be for the patient, because you're not only treating that patient, but you're treating the family as well.
Sure.
Um,
Sure. And
so,
it
yeah.
almost sounds like hyperbole to say, but you're absolutely right. Because I would tell people all the time when I was did a rotation in the hospital, I would tell family members that they ought to be walking out with a PT degree, maybe even a little bit more, because they've just learned so much in such a short amount of time of how to take care of their loved one. And it could be for something as simple as a knee replacement, and they end up doing a ton for their loved one. And yeah, I don't think it can be overstated that that role of the family member, especially in the face of something that may be a little bit more significant, like spinal cord injuries, neurological issues, cancer, things like that, they're going to basically need to have their facts straight and understand what they're doing, and actually have um, a little bit of an understanding behind the reason of everything that they're doing, as opposed to just doing things that are listed on a sheet. Do you have plans set in place for that education?
Absolutely. So I'll have, handouts for, patients that have had stroke, things to look out for,
Mhm.
things that they need to be aware of, things if they've not already gone through this with their neurologist. So these packets will be in place for impairment specific diagnoses.
Yeah.
So that's something that I think is super important, because oftentimes patients, there's a lot of information that's given during an encounter.
Sure.
And especially if you don't have someone with you, it's hard to sometimes assimilate all of it. So to have a packet of information that you can take home as a resource, as a guide, she's like, oh yeah, I can, that she said that, and they can take time to look through that, and have that information to go home with.
Yeah, I've
Um,
started shooting videos because I spend, even spending an hour with somebody, I'm self-aware enough to know that I talk a lot at them, and I'm just kind of brain dumping as many things onto their plate as I can. And I got to this point where I was like, I am so sick of writing this out in the email to you to recap it. So I'm just going to shoot a video of the point that I'm trying to make and have it general enough to where everybody can understand it. And I think I've gotten a lot of good feedback on that. And I think that's something that, even for the patient, like you said, and usually, like, if it's an encounter where they've got something a little bit more serious going on, they've got some drugs in their system, they've got something that doesn't exactly make it easy to remember.
sure.
Isn't it that we only remember like 7% of what was told to us?
Right.
Yeah.
Exactly.
And so, like,
Exactly.
obviously you have a lot more that is important to tell somebody than 7% of what they're taking in. And so if they can take what you have and just go back to a sheet and remember it, I'm sure that's going to be fantastic for everybody involved.
Absolutely. And I think that the caregiver education is super important as well, because, when someone's been in the hospital for a long time, they come out of the hospital, oftentimes they need a significant amount of resources, of therapy. There's a major family dynamic that's changed. There's a major life change. So does the caregiver and does the patient, do they feel comfortable managing medications? Do they feel comfortable with transportation, with handling finances, with helping the patient with therapy needs,
Yeah.
meal prep? Do they feel comfortable with, if they have specialized equipment like a Foley, an IV, feeding tube? All these things are super important to make sure that that caregiver understands. And there are resources. After having gone through this personally with my parents,
Hmm.
um, not only from a medical background of being in rehab medicine, but also from a personal note. My dad was diagnosed with a spinal cord injury 2.5 years ago, and so I've had to sort of switch roles and put on a daughter caregiver hat, and and I've learned an extensive amount about what resources are available in the community to help patients who don't have a lot of extra funds laying around.
And you're a
There are free
doctor.
resources.
You understand this stuff. I mean,
Right.
imagine for people that like just have no medical training whatsoever. It's got to be just an absolute, finding a needle in a haystack trying to get to the point.
Absolutely. And so I think, having gone, I know we go through our experiences we go through things for a reason. And I think it's to help other people. So, I'm grateful that I was able to, learn about these resources in the community to help provide patients and their families with things that they may not know about, that they may not be able to otherwise afford. And these are things like home care, home health aides, nursing, meals, respite care, transportation assistance, in-home medical care. I mean, just a whole wealth of information that goes along with having someone with a handicap or being that caregiver.
Yeah.
So,
Yeah. And I similarly had a situation with my family where I wasn't the caregiver, but my grandfather had fallen ill. It was a whole lot of things going on, dementia on top of all that. But he moved in with my uncle and his 5 children plus his wife. And every single one of them, they really, I'm really impressed by them because they all picked up the torch and they ran with it. And it was like a before school kind of routine. We're like, hey, it's your turn to go get Papa Bill and help him downstairs or help him to the bathroom and all that. And then you can go to school.
Mm-hmm.
And they really ran with it. But I really can't believe how much you have to learn, how much you have to put yourself through to get to that point. And it took it to where there were 7 of them with at least one of them looking after him all the time. And that's one person. So, I agree with you that it's something that is, it's really important for anybody who's not only the patient, if they're with it enough to be able to understand, take care of themselves, but also the caregiver, to have a lot of that education, if not more so sometimes.
Oh, yes, absolutely. Because, I think it's, for us personally, we wanted, to have my dad at home to provide as many in-home services as we could, so that we could spend more time with him and make sure that, the quality of care was what we wanted. We would set the level of quality of care. So, to arrange, home health physical therapy, occupational therapy, to, home health nursing to come in. And some people actually have long-term care insurance that they may or may not be aware of, and even certain Veterans Administration benefits where a home health aide could come in to the home at little to no cost, which is a tremendous blessing to have that, so you wouldn't have to pay out of pocket,
Of course.
for those things.
Yeah. Because I think people are hard on themselves. I think they are, especially people in the medical profession who are like, I know the level of care he should be getting, and we all know that there's just some people do a better job at certain jobs than others. Not one particular profession in any way, but there is a high quality of everything, a low quality of everything, and medicine is no exception to that rule, unfortunately. And so when we see our family member in particular receiving some of the lower end, we want to be able to pick up the slack. It's a full-time job.
It is. And if I can help a family keep their loved one at home and to allow them to provide that care at home, I would love to be able to do that. Just to provide the expertise that they need to keep them at home.
Of course. And this is all culminating into, I think you obviously, or you wouldn't be doing it, you saw a need that wasn't being met on a regular basis. And I know we've touched on it here or there, but I don't think we've ever really directly gone after that in this interview. Can you speak to not so much why you're doing it, but what you see that is lacking, that whether it's because there's just no time for it or some other random reason that you're trying to fill a hole that is out there in the medical world right now?
Absolutely. So I think there's a really big need for rehab medicine in the triad for a number of reasons. The first one is, where I came from, Wake Forest Baptist, they had a very robust outpatient rehab practice. Unfortunately, there were some things that the climate had shifted and things had changed, and they're no longer able to provide those services, but they have an incredible inpatient rehab. However, the outpatient rehab is not there. And so oftentimes what happens is a primary care provider or a neurologist or oncologist, they're trying to not only do what they're good at, but they also are trying to manage therapy needs and other rehab related needs. And so, and it's a lot to deal with. The rehab physician should be the one to manage the therapy needs, the impairments related to certain conditions or disorders. And so, and there's no other outpatient rehab doctor in this area. I know of some personal ones in the Charlotte area, as well as Raleigh, but there are none in Winston-Salem and Clemens, particularly just providing rehab medical care. So, my main interest is to the inpatient rehab model is such that there is a team-based approach with physical therapy, occupational therapy, speech therapy, rec therapy. There's a psychologist, there's social work. My ultimate goal is to have that type of clinic or that type of setting in a clinic setting, so in an outpatient world, to have all the services under one umbrella, so that there is that team of providers in the clinic. But that's gonna take some growth and some time.
Of course.
But immediately I'll have I mentioned earlier physical therapy, occupational therapy, as well as health and exercise provider. So I'll have a small gym in the clinic. There are several therapy rooms specifically for physical therapy, as well as clinical exam rooms for me to see patients. So there really isn't that type of practice here in the Winston area or the Triad.
Oh, and I can speak to that because I've had people call into my clinic looking for help with outpatient needs so far as spinal cord injury. And I think one in particular that I keep going back to is somebody that was in a car accident. And she was like, I was released from the hospital and that was it. And that's the thing that I don't think maybe everybody always realizes is that, yes, we have great places to go here locally for that immediate issue that could save your life, and it could make sure that, okay, yeah, we're out of the woods with this brain injury, we're out of the woods with this cancer. But what we all know is that it doesn't stop there, and it can't, but oftentimes it does for people, and there's none of that continuation into, okay, what's after, because I'm left with all these impairments that I need help with.
Exactly.
Most
Exactly.
people have devices.
Exactly. They are. And like you said, there's no continuity of care from the time they're released from the hospital, whether it's from surgery or inpatient rehab or just from a prolonged stay in the hospital. They're left to go home and they don't have that that continuous care in the outpatient setting. And I would, love to see patients who, who may not have that that system in place when they've been discharged from the hospital, and they may or may not be able to get in with their primary care doctor, or they just may feel like they're just deconditioned or debilitated, and they don't know what to do at that point. So those are the type of patients that I would love to see, love to help. Maybe they've been in that they've had a stroke. Well, they may be able to walk fine, or they may be functionally fairly normal, but they're depressed and they're anxious, or possibly they do have a slight gait abnormality that hasn't been appropriately addressed or hasn't been treated. So that's the type of things that they can help with. Or they're feeling overwhelmingly fatigued, poor endurance, balance issues, dizziness,
Yeah.
bowel or bladder dysfunction, whether we know the cause or not. That's something that a physiatrist, such as myself, would feel comfortable brainstorming and troubleshooting and helping to provide treatment for.
Yeah.
Um,
And that's great, because I think whether it's right or wrong or unfair, a lot of people that have these problems that aren't deemed as immediately life threatening, or something that can be fixed by pills, like my blood pressure is high, or I have, I don't know, low O2 sats, something like that, then most people are going to be given the whole, pills and rest runaround, and then maybe a sheet of exercises, but that's about it. I know, at least from the orthopedic side of things, I can tell that story over and over again. Basically, every person that comes in here has been through that. And I think that has a little bit to do with the fact that nobody knows, like you said, nobody knows what to do. I think it's just assumed that, all right, I'll go to my primary care, and most of them will do a pretty good job of referring you out. But then what? What if you get to a specialist who basically either wants to pass you off or can't help you, and it's out of their realm, and they don't really know where to put you next? And again, that's why I wanted to have you on here, because I know that you are, for lack of a better term, putting together this all-encompassing, like, if nothing else, we will have something to do for you that may not be as cut and dry as, okay, here's this pill that's meant to fix your problem. This is actually like a lifestyle change, or a movement thing, or just something other than the traditional. And it sounds weird to have to say that, hey, I'm non-traditional because I treat the whole body without trying to just jam medicine down your throat. But that seems to be the rub that people like yourself and I get.
And I think that's, at the core of my, training. We have lots of training in internal medicine and disease specific processes. So, if there is, before I start with a treatment program, I want to make sure that medically the patient is where they need to be. So if, like, for example, if they're feeling incredibly fatigued, if I'm not able to get in touch with a primary care doctor, or they don't have one set up, I would be happy to take the initiative to order those labs that may evaluate for, a nutritional deficiency, electrolyte deficiency, or let's say that they're weak on their left arm and we haven't yet worked that up. It's certainly either, go ahead and order the MRI or order an EMG, as well as, consider referral to neurosurgery or whatever the case. So, there's a pardon?
So that there's no more of that waiting, like 3 months
Correct.
between answers that may or may not help you.
Correct. So, but yet using the, traditional based medicine of, ordering laboratory studies or electrodiagnostic studies, imaging studies, that's something that would certainly be a part of a plan. So.
And that's what I want to stress to people, is that, call it what you want to, but this is based in science and it's based in research. And this is all stuff that, I guess we just wish was part of the regular treatment plan, but it's not. And instead of fighting it internally, I guess what you and I have done in kind of separate worlds is gone out and tried to create clinics that address the whole body, address the whole person, so that we can make real changes quicker and get that whole picture. And then people hear whole picture, they're like, oh, so holistic. And you're like,
yeah.
I guess.
And I just love your approach and your philosophy. And we've talked so many times, and just even come into your clinic. The time that I did, you're like, this is how I would treat a patient. You just do a top down, and you just look at the whole person, the shoulders, the hips, the ankles, and you have that approach that not everybody has. And I think that's one thing that sets you apart, and the time that you're able to commit to spending with patients and listening to them. So you're doing just a phenomenal job. And
thank you so much. I wish I could say that I came up with all of it and I just pioneered this stuff, but it's not new. It really isn't. I've just taken the time to learn this stuff that may not be as obvious coming out of school to a new PT. It may not be something that you're exposed to.
Mm.
because it is what it is. School is there to help you pass a test. Obviously, I heard not of my program, but a leader of a program one time basically say, like, listen, we're just trying to get you out there where you are competent enough to where you don't kill anybody.
Oh goodness.
It
That's,
sounds terrible, but it's true.
but
I mean,
it is true.
you can't stop learning when you get out of school, and that's I think that's what you have to do if you're gonna bring a clinic to the table that's actually gonna help people and create meaningful changes. But above all else, being able to spend time with somebody reigns supreme, because you can be a great just the world's greatest multitasker. But if you're trying to treat three people at the same time, it's like trying to look at something through binoculars while somebody's flicking you in the eye.
Right.
If you've done that for a year and you've just gotten used to somebody flicking you in the eye, it doesn't stop the fact that you've got this distraction going on, and being able to focus on this one person, spend a little bit more time in assessment has helped me. And I know you agree with this. It's helped me spend less time in treatment, because now I know exactly what's going on. I'm not guessing anymore. This is what's going on. And yes, we have to work on adapting your body at different stages. So it's not a one-off, here's a bunch of exercises, go home.
Mhm.
But it is something to where I get a lot of certainty on day one and can basically show it to you. And I think that's something that's so powerful, not just from physical medicine, which I know you do a lot of as well, but just internal medicine, being able to show somebody what is going on, speak to them on their level, out of this ivory tower setting where you're tossing around a bunch of medical terminology, and just give them an idea of, hey, here's what's happening because of X, Y, and Z. Here's what we have to do to make you live a better life.
Yes.
And I love that
That
that's what you're bringing to the table. I'm so excited for this thing to get
well,
rolling.
thank you.
Yeah, I really am looking forward to Winston-Salem just having this one more awesome access point for people to get great medical health care, because
Well,
it
thank you.
is something that is needed, and I'm really excited that you're bringing it in.
Thank you. I really do appreciate the opportunity to be on your podcast. Or
Yeah. Hey, for
so,
all 8 of you that are watching this, we're gonna do this again. So
right.
hopefully I'm grossly underestimating that number. But hey, I wanted to give you a chance really quickly to talk about just anything else that you may have missed out on while we were talking earlier about all the different medical diagnoses or different people that you might be able to help, because we're going to wrap up here in a second. So just give me your best recommendation of everybody that you can help, and then I'll tell them what they need to do to keep tabs on you going
Okay. All right, that sounds great. So just a few other little tidbits. So let's say you've been out of work because of an injury and you're looking to go back to work. I will have the software and the tools to do the return to work assessments. Also, disability screenings, and it's in the works. There's going to be a transportation component to the clinic. So like I said, that may not be available day one of clinic opening, but my husband has a transportation company, and we're looking at providing non-emergency medical transport for patients, and possibly even shuttle services. So that will be hopefully on the horizon, but definitely more to come on that end.
And you guys, that might not sound like it's that big of a deal, but trust me when I say that is a freaking huge deal. There are not a lot of places that will provide that for you, and it is tough to get put together, especially the return to work stuff. I know that's not an easy thing to get your hands on and get into. So claps all around for that. That's a really cool service to be providing for people. Okay, well, we have run our time out here. I appreciate everybody that is coming on and watching this. Again, I hope you guys are having fun watching these interviews, because it's not a way for me to give you specific medical advice on anything in particular. It's really just to broaden your horizon on what the medical system can provide if you do a little bit more digging. And I know that niche companies like myself have a really hard time marketing ourselves, because not everybody quite gets it. except for other niche companies, which is why I speak to people like Dr. Hill here and let them have this platform to speak about why they are special and what they do. Maybe that's a little bit different, that may not seem traditional, but I can tell you from the inside is the direction that a lot of the medical system is moving in. And people like Dr. Hill are pioneering this for Winston-Salem. It's not something that she's doing just to try to open up a business that she thinks will be just crazy lucrative right off the bat. She's doing this for the people in the community. I can't stress that enough. So this is how we're gonna keep tabs on her for now, because the company is still in the works. It's not quite going yet, but there are definitely steps in place to where it's a thing. It's gonna happen here in the near future. Do you want to tell them a date yet, or do you want to hold off on that?
So we're looking at probably early summer. There's, like Tyler, there's just a few other things that need to be put into place, a few more pieces of equipment, a few more items, but hopefully it'll be early to midsummer.
Yeah. So if it's not, y'all don't worry about that, because it is coming. I've been talking to her about this for, I don't know what, like almost a year now. We've been chatting about this, because you came into my clinic like right before COVID hit. I think it was like that day that I was pretty sure the National Guard was rolling into town. So yeah, we've been talking about this for a year. She's been really, really steadfast in getting this done, really committed to it. And I'm excited to see what it's going to come to. I'm going to do my best to keep you guys updated on what she's doing. If she has anything like a website, which I'm sure will be coming eventually, ways to get in contact with her, I will make sure that I put all that information on my Facebook page, as well as email it out. And we're going to do this again, because like I said, she and I could talk about a million different things probably all day given the chance. So I'm not worried about having to come up with something new. I'm sure by early summer, there's going to be a lot more that you guys will be interested in learning about. So we'll do this again for you guys and have her back on so that she can tell you maybe even more specifically about a couple certain things. What I would like to do is really just get into the nitty gritty of certain conditions so that people can have this specific understanding of what you're bringing to the table for these things. So if, say, somebody has cancer, let's just do a full day of, let's talk about this type of cancer, maybe what's in your head for that person, so that people can, again, not get specific medical advice. This does not take the place of any of that, but get a little bit of a different perspective than they might be from a day-to-day practitioner that would otherwise just be referring them out to somebody who's a little bit more specialized.
That sounds awesome. Tyler, thank you again.
Yeah, no problem.
All right. And we'll be in touch.
Yep. Sorry, I didn't mean to cut you off. Your voice.
Oh, no, we're fine.
Yep, we will do this again very, very soon. Thank you very much.
Thank you, Tyler. I really appreciate it.
No problem.